All right, so my name is Davina DeBolt, and my audience today is Alex, you gotta show yourself, there you go, Sharon and Alexander, and I intend to persuade my audience to advocate for behavioral health care coverage for autism and developmental disabilities. So here we go. Thank you for joining me for part 3 of this 3-part series entitled You Should Care About This, Behavioral Health Care Coverage for Autism and Developmental Disabilities. Before we get started, I would like to show you a short video clip entitled Living with Autism Through the Eyes of a Child. The child shown in the video likely has a mild to moderate form of autism spectrum disorder and actually has decent coping skills with accounting. In the end of the video, however, he does dissolve into an anxiety attack type behavior that his mother has to manage in the middle of a public space. As a registered nurse working with the autism and developmentally disabled population in both an acute and residential behavioral health setting, having behavioral health care coverage for this population is very important to me. The problem that exists is, though autism does have protected coverage via private health insurance and in the medical community, the Georgia Department of Behavioral Health and Developmental Disabilities lists autism and developmental disabilities as excluded coverages. In the next 5 to 6 minutes, we will discuss why this is a problem and what can be done by you and others in the state of Georgia. To understand why taking action is needed, let's first discuss what the problem is with current policy. Okay. According to the Marcus Autism Center, a subsidiary of Children's Healthcare of Atlanta that treats children with autism and other related disorders, Georgia's autism insurance reform law required private insurances to cover services such as applied behavioral health, analysis, counseling, and various therapies. However, according to the National Conference of State Legislature, whose mission includes improving the quality and effectiveness of state legislature and to promote policy innovation, Georgia's only required coverage prior to this was for neurologists to not refuse treatment to children with autism spectrum disorder. The Georgia Department of Behavioral Health and Developmental Disabilities fiscal year 2016 provider manual for community behavioral health providers, which is the guideline by which providers base care costs, length of time, therapies offered, etc., unanimously excludes autism spectrum disorders and developmental disability diagnoses from each category of coverage. In fact, there are 42 references to autism within the document, and all of them are under clinical exclusions. The developmental disability or mental retardation is also listed under clinical exclusions. The caveat to this is that these diagnoses may be covered with a co-occurring psychiatric or behavioral health diagnosis. So let's review. Autism and behavioral disabilities are not covered unless they exist with a co-occurring disorder such as anxiety, depression, or something as vague as unspecified mood disorder. Meanwhile, the Centers for Disease Control estimate that 1 in 68 children are on the autism spectrum. That translates to 1 in every 2 elementary school classrooms. And that 1 in 6 are living with some sort of disability, which includes autism and developmental disabilities, and that translates to 5 in every classroom. Treatments that may be needed by children with these delays are typically referred to as interventions, as autism and developmental disabilities are incurable, but target behaviors or symptoms may be manageable. According to Autism Speaks, the world's leading autism science and advocacy organization, interventions that may be needed for autism include behavioral interventions and medications. Interventions inaccessible to individuals living with autism unless they also affix another label or diagnosis to them. Diagnoses follow individuals from one medical setting to the next. Now that we understand the problem, what is the solution? Well, obviously we need two things to happen. First, we need parity, which means equal treatment for behavioral health coverage in comparison to our medical health coverage, which was discussed in part 2 of this series. Second, we need autism and developmental disability coverage to be fair and equal to other disorders affecting our behavioral health population. Schizophrenia, for example, is covered. Schizophrenia is an incurable disease. Individuals living with schizophrenia will have that disease for the rest of their life. That's treated by medication and therapy, the same interventions that are used for autism and developmental disabilities. So how do we bring about this change? We advocate. We as nurses should be advocates for our patients. The American Nurses Association Code of Ethics for Nurses Provision 2 states, the nurse's primary commitment is to the patient. The American Association of Colleges of Nursing notes that nurses are numerically the largest body of healthcare professionals. If nurses in Georgia, as well as you, the audience, and those you know, advocate for the autistic and developmentally disabled community in Georgia by writing to senators, representatives, or even the Georgia Department of Behavioral Health and Developmental Disabilities, we may be able to help get coverage for things like family training, family therapy, and individual counseling. In closing, I would like to remind you why this issue is so important. 1 in 68 children living with autism and 1 in 6 with a developmental disability. According to the CDC, there were almost 4 million births in 2014. That means that, if trends hold, more than 58,000 children were born with autism and almost 667,000 were born with or will develop a disability. Autism and developmental disabilities are not covered right now, but with your and legislators' help, they could be. I implore you to write just one letter to a legislator regarding this issue. And you can do that and find your senators at senate.gov/senators/contact, or for the House of Representatives, house.gov/representatives. Thank you for joining me for part 3. You should care about this behavioral health care coverage for autism and other developmental disabilities.